cases. In the race to vaccinate tonight, more than 50% of New Yorkers have had at least one dose of the vaccine. This while hospitalization numbers continue to rise. On Sunday, ECMC in Buffalo announced changes to its patient visitation guidelines, saying it was necessary due to, quote, historically high inpatient volumes, extended wait times in the ER, and increasing number of COVID cases. Well, as of right now, the new visiting hours are from 1 to 7 p.m. Only one designated inpatient visitor is allowed per day. Patients with COVID-19 are not allowed to have any visitors unless they are gravely ill. And all visitors are required to comply with ECMC's screening checkpoint procedures, must wear a mask at all times while inside the hospital. Well, with the increase in COVID cases, there are fewer hospital beds available across this region. 7 Eyewitness News senior reporter Eileen Buckley taking a look tonight at why hospital capacity is becoming a political football.
It's the county executive himself who has blamed the mask mandate on hospital utilization.
Town of West Seneca Supervisor Gary Dixon says Erie County Executive Mark Poloncarz is blaming hospital capacity for demanding and issuing a mask mandate at businesses again.
It's really only because we have fewer beds now, and that's causing the big problem. If we had maintained those beds, we would not have the problem now.
Dixon says, unfortunately, there is a more than 10% drop in hospital beds in the county, according to data from the U.S. Department of Health and Human Services, and it has left hospitals vulnerable. Governor Hochul has announced urgent action to boost hospital capacity. The Department of Health would be permitted to limit non-essential and non-urgent scheduling of hospital procedures.
We know exactly the hospitals. We're talking about probably 32 to 36 hospitals right now that fall into that category of having 10% or less bed capacity.
Governor Hochul addressing the issue Monday afternoon, saying hospitalizations are going up and it's very concerning. But Supervisor Dixon and State Senate Republican Minority Leader Rob Ord say they believe hospital staffing issues is the problem, not just COVID cases.
I'd like to know how much of the capacity issue is related to staffing shortages versus actually, not having enough beds, and also how much of it is related to COVID specific.
And Ord says he believes there are fewer healthcare workers due to Governor Hochul's vaccine mandate. But Hochul says she's not backing down on her mandate.
I will not be backing off on that. That is something I believe worked.
County Executive Poloncarz continues to sound the alarm bell of spiking COVID cases. In this tweet, the county executive says hospital admissions prove COVID-19 is a wildfire burning across Western New York. Poloncarz using this graph to show the same time last year that there were 379 COVID patients in all Western New York hospitals, and right now there are 478. I reached out to Poloncarz's office for an interview, but was told he wasn't available. And in a statement, it said in part to slow and reverse the troubling increase in COVID-19 cases and hospitalizations, we have to continue to take measures as a community to reduce risks across all settings. Eileen Buckley, 7 Eyewitness News.